Hello and welcome to today's podcast. What I want to explain today is, what is a smart injury doctor? What is this all about? What is this idea of a smart injury doctor? Well, here's what a smart injury doctor is, and I wanted to define it today as the first podcast. A smart injury doctor is an extremely effective injury doctor. Now, what does that mean? It means they're extremely effective at three things. It means they're extremely effective at the ability to diagnose the injuries that the patient has. They don't miss injuries. It means they have the ability to treat the injuries that they've diagnosed. And it also means that they have the ability to easily document everything about the injury and everything about the patient that is injured, so that those who are in the benefits adjudication process, such as insurers, attorneys, plaintiff attorneys, defense attorneys, can easily understand what benefits the patient should have access to. That's what a smart injury doctor is. They live, breathe, and die injury results. Everything that they do is based on getting better, faster, more effective results for patients. They provide the services that they themselves would want to receive if they were injured. Now, these doctors oftentimes make very good money, but they don't promote how much money they make or how much money they make on a claim. Today in the injury market, there are so many doctors that actually talk, all you hear about as a doctor is how much money they make, but you never hear anything about the results and the results with the patients that they treat. Smart injury doctors are different. While they may make a great deal of money, their primary focus and what they're talking about and trying to understand and figure out and improve on is all patient results. That's what a smart injury doctor is. A smart injury doctor knows that their job is to reduce insurance benefit needs, so they know that they are the best friend of the insurance industry. As a smart injury doctor, we know that insurers want patients accurately diagnosed and fast and effectively treated, so that they don't have long-term benefit needs. That's what everyone in the market wants. That's what patients want. So in the last 30 or 40 years, I've been in the injury market, spinal injury market, for 30 years now. And it's always interesting to me to hear doctors and lawyers who are in the injury market always saying the patient is only interested in money. These people are interested in money. A person who's injured is interested in money. I say, wow, that's such a bad doctor's point of view. It's certainly not a smart injury doctor's point of view. It's a bad doctor's point of view. Because what the doctor is saying is, look, the person has a ligament injury at the base of the neck and now they have migraine headaches. Good, so they were in some kind of an auto accident, they got a settlement, they got $4,000 in their pocket, but they have to have migraine headaches for the rest of their life. Would anybody get, would you pay $4,000, $5,000, $50,000, $100,000 to have a condition cause you migraine headaches for the rest of your life, and that life being about 50 years more that you're going to live? So you're young. No, of course not. So whenever anyone is injured, what you're looking for is a supremely confident and competent injury provider. That's a smart injury doctor. That's what smart injury doctors are. Whether they're medical providers, osteopaths, doctors of chiropractic, doctors of physical therapy, it doesn't matter what kind of doctors that they are. They're extremely confident and competent. With competency, the ability to do things, comes confidence. So what a smart injury doctor is extremely competent and confident, and everything they do, again, is geared toward better education. They're willing to spend money on education. They're willing to spend, because they understand that when they are educating and improving themselves, they're actually affecting every patient they're going to touch from that moment forward. And that their job is to rehabilitate and change lives. Look, when a patient, let's say a patient comes in, let's say a mother of 3 children comes in with a serious neck injury, right? And she's married, she has 3 children. The doctor's not just, a smart injury doctor recognizes that you're not just treating that woman, you're treating the whole family as well. If she cannot get rid of the migraine headaches, Will it affect their relationship? Of course it would. Would it affect her ability to have relationships with her children? Yes, it could. So you're not only treating the person, but you're treating everything dynamically that is connected to that person. And that's what a smart injury doctor realizes. Right now in the injury market, injury care is unsustainable because it's ineffective. It's very ineffective. In the spine area, it's ineffective. The primary reason why it's so ineffective is because the primary doctors that are treating spinal injuries don't even know what the injuries look like that they're treating. So a dog, when it bites you, leaves an injury behind. It's very, very easy to understand, and it's very easy to understand in the dog bite market, say, that if a doctor didn't know what a dog bite looked like, they probably wouldn't treat it all that well. The results of treatment would not be that good. In the US spinal injury market, the majority of doctors in the market do not actually know. They can't tell you exactly what do these injuries look like. With specific injuries, what do they look like? And all injuries are nothing more than derangements. Smart injury doctors know this. They know exactly how to diagnose the injuries, and they use the best professionals around them. So smart injury doctors are smart in the fact that they don't try to do everything or be everything to everybody. They don't try to do imaging and imaging results and try to read the images all themselves. When they need images, yes, maybe they take x-ray images in their own clinics, but they have professionals interpret those images for them. If they need an MRI, they send out. They find the best MRI centers and work with the best professionals that they can in their local area. If they need a CT, same thing. If they need a medical specialist, same thing. So they work to find the best doctors in their area, and they network because they know they can't do everything. And they don't even want to do everything because they know what they want to be really good at is the treatment of the injuries that they've actually diagnosed. So that's what a smart injury doctor is. It's a new breed of injury doctor that is results oriented. Results are in the DNA of a smart injury doctor. They're what patients should be looking for, insurers should be looking for, and employers especially should be looking for, because work-related injuries today, the costs are at unsustainable levels. Everyone in the market knows that. So it's the smart injury doctors that should be getting all of the patients possible. And yes, we need to create more smart injury doctors. Again, that smart injury doctor is in the front of the bell curve. They're not an average doctor. They're not striving to be average. They're striving to be in front of the bell curve for their particular profession in the area of injuries that they handle. I hope that helps you to understand what I mean when I say a smart injury doctor. Thank you.